A documentary showing the plight of healthcare workers amid COVID-19 and what they have to deal with comes to light in the documentary called 020, which will hit screens next month. The documentary will be broadcast exclusively on DSTV's Mnet channel on October the 4th, showing never-seen-before footage of frontline healthcare workers who are battling against the coronavirus. For more on the story, I'm now joined by Professor Leonie Scholtz, who is a radiologist and part-time filmmaker. Prof, a pleasure to have you on the program this afternoon. Speak to us firstly about what this documentary is about.
I think the documentary in essence is about the effect of the pandemic, not only on patients but on the healthcare workers. And I think also the message probably is the strength of the human spirit when faced with adversity. But I think nobody has seen the kind of footage, and it's a very important message that needs to be conveyed, because there are still some people thinking that it's people exaggerate, but it's an honest look into the effect of the pandemic as it plays out in the healthcare sector.
Now, Prof, as we mentioned earlier, this documentary will show never-seen-before footage of frontline workers. Let's just take a quick look at the quick trailer of this documentary.
Travel restrictions are now being considered worldwide. 98 people have tested positive for a new virus strain.
This story reveals the indomitable spirit of the staff and patients in the capital city of South Africa.
This is patient 0, and she's the first patient that we've admitted with the COVID infection.
Extensive COVID-19 pneumonia.
The physician already phoned us to prepare for the worst.
There was a time when literally patients would just die. A lot of people who are dying require that human touch, and COVID has taken that away. Somewhere there is a light at the end of this tunnel. Let's hope for the dawn to break.
Professor Scholtz, as we saw there, the struggles of frontline workers have also been widely reported on since the outbreak began. Now, you are a radiologist by profession. Speak to us about your own experiences and that of your colleagues.
Well, certainly, as a radiologist, I've never seen the extent of the involvement of the lungs as we've seen and experienced during this pandemic. It is actually mind-blowing to see one patient after the other with extensive involvement. And then the other two characters that we followed, by the way, we were a team. It's me and Shem Kompion and Crystal Lautechan who did it together. It's not only my own effort. Yeah. So we followed two healthcare workers. The first is Dr. Leonie Scholtz. She's a alumna of the University of Pretoria, and she is now a physician working at the Zuid-Afrikaanse Hospital, and we followed her while she dealt and managed and helped patients through. And we concentrated on some of the patients just to make them real people, because all the footage we see is footage with patients blurred, so they're not real people. And we show the effect on them, on their families afterwards, before, and some of them, some of the couples we recorded footage of. The other is our second character is Professor Veronica Uckerman, and she's full-time at the University of Pretoria, also part-time at Zuid-Afrikaans, and she also steered the pandemic after Professor Scholtz passed away last year. So we followed them, and we asked permission from the patients, filmed them when they were intubated, when they were going through the whole process.
And just to give us your insight as to whether you've noted that the situation has improved in recent times, especially as we're seeing an uptake of the vaccines, not just from medical workers, but also people over the ages of 18.
Yes, definitely. Well, certainly Gauteng, we've seen a lot of improvement. We're still sitting with a lot of backlog of the patients that came in with the third wave, and it's now very bad, I think, in the Cape. But since the vaccines came in, we not only exclusively, but we mainly see patients that are not vaccinated in our ICUs. So there's a plight from the healthcare workers side for people, please, to get vaccinated. People, like I saw in a news clip the other day from Tygerberg, people came to doctors and they trust them to treat them. Why don't they trust us when we say, please get vaccinated? There's scientific evidence for that. Because we see the patients now in our ICUs that are not vaccinated. And it's still a huge burden on the healthcare system. And it's not fair. People need to get vaccinated. So there's hope. I think it will improve. It's taking time. And we didn't expect vaccination to immediately be the solution for the immediate problem, but because we need to vaccinate a lot of people. But yes, there is hope now, and certainly it has changed a situation of despair into a situation of hope.
And as we wrap up, just quickly remind us again when the documentary airs and where can we watch it?
It is an Mnet executive production of Mnet, and it will be viewed on the 4th of October. It's a Monday evening at 8:30 on Channel 101, Mnet Main Channel 101.
Right, Prof, thank you very much for your time. That's Professor Leonie Scholtz, a radiologist and part-time filmmaker, speaking to us there about a documentary that gives us a rare insight into some of the challenges faced by our frontline workers in the fight against COVID-19.